Don here. So Don is a Masters runner, but he does have a history of Achilles tendonitis and hamstring strain on the left leg, I believe. But he's not really experiencing anything too crazy, but a little bit of soreness into his second and third mile in his hamstrings. So we're gonna look at his walking first, and like I said, this is something that I typically do anyway, just to see what someone looks like at a relatively normal and consistent pace. Again, if this is on a treadmill, feel free to have them, go a little bit faster sometimes, but being pain free and you're actually more interested in the running, this is perfect. So what's this, like 2.8 miles per hour, something like that. Really good, symmetry in his stride. We saw the symmetry and contact swing time is good. The cadence is also good relative to his speed. So all of that looks good. And then when you look at his walking profile, you can see that, very consistent in his stride. Also very similar in his profile breakdown between the stance phase and the swing phase. So we go down here. Let's look at propulsion rate first. I think I'd mentioned this, but I don't get overly concerned unless I'm really hitting double digits. And we're seeing that we're definitely in low single digits and pretty equitable between, the hip flexors and the plantar flexors. Um, he's certainly not old. He's only 60. So I wouldn't expect any strategies, especially the fact that he is a runner. Um, Sometimes we tend to see the literature tells us that older adults tend to have compensatory strategies in their lower limb, and so they tend to reduce recruitment in the hip flexors. Most likely something to do with one, their walking speed, two, their strides, and three, just lack of core engagement, oftentimes due to weakness. But this is certainly not the case for him. Um, so looking at his gait line, so we see here, it's in the red here, it's in amber here. Yep, he heel strikes and transitions relatively rapidly, and then we see the midfoot is on the high end and the propulsion is on the high end. Probably common. I'm curious, maybe that's not his typical walking speed. He may walk a little bit faster, and again, that's fine. There's nothing wrong with that. We do see that he does tend to heel strike relatively on that outside. I'd rather see on this right foot. I'd rather see that dot right here. So this is, I think I'd mentioned, so this gate line is a representation of the center of pressure using uh, um, an algorithm. And so we're not actually measuring pressure, so we're looking at the orientation. But I like to look at this, as a general anyway. So he seems to rapidly transition, almost linear in on that right side. A little bit better here on that left side. I'd like to see, this again, spending a little bit more time on that lateral aspect when we're getting to that transition. So it looks like he transitions into a relatively pronated foot position right after heel striking. And if we go further down here, right, the benefit of heel striking that far off on the outside is he never really gets into that pronation stage. But I'd be curious. We're going to look at gait line here or excuse me, the foot progression angle here in a second, and the amount of circumduction. But his pattern looks good, right? So he starts on the lateral aspect and transitions eventually onto that first and second ray. But he does spend a lot of that time initially on the outside, and this is pretty significant. My guess is if we had um, some kind of lateral wedge or post, could even just be a very simple heel cup, what that might look like in terms of transitioning, and it might shift this whole graph over, and it may not affect propulsion. So that's why I keep some of those in the office, just so we can throw them in the shoe and see what that looks like, see what that feels like. within reason here on that left side, pretty good standard deviation on propulsion. So it seems to be progressive after heel strike. But again, he's got a pretty good pattern. So if I wasn't aware of anything that was going on, then I would say, yeah, nothing really to correct here. But if I walked him faster, I would wonder what this would look like here. And obviously, we're going to look at the running here in a second. Yep, so foot progression angle, so it is more than double on that right side. We also see his excursion is almost double, so he's swinging that right leg out for some reason. But um, this is where regular testing is going to be interesting, because maybe the 12.9, because that's within the normal deviations. So asymptomatic population studies have shown two standard deviations from 14 plus degrees of external rotation to about -2 degrees of internal rotation. So both of them are within that normal range per se, asymptomatic range. But he's very asymmetrical in that for some reason. And it could be his 12.9 might be the norm, and his issues on that left side might be the reason that he's doing this. Although you said one of those issues was an Achilles issue. So again, we'll look at the running and see what that looks like. If he doesn't have any right-sided, and this is the norm, that could be possible, and that certainly explains this up here, why he's really heel striking and his rapid transition over into that. Can we fix it? If he's got tight external rotators, and I see this in people that drive a lot. I don't know if he's a golfer, but this degree of asymmetry, it happens a lot in people that golf a lot, right? If he's right-handed, I would suspect, if he is a golfer, I suspect he's right-handed, because when you're taking that right-handed swing, very strongly you go into and you finish that, into an internal rotation of the forward leg, which is going to be the left leg in this case, and an external rotation of the right leg, which is the back leg in this case, being a right-handed golfer. So sometimes that happens. Do we want to correct that? I'm not sure, but if he eventually starts to have some problems, I would look at, he might have some, tight external rotators. If he eventually presents with, some piriformis syndrome or something like that, then that kind of stuff would lead me to believe that, yeah, that's, part of the issue here. But he does definitely heel strike on the outside as a relationship to the amount of foot progression angle that he has here. And again, he does have, double the circumduction. It's not horrible because, keep in mind we're looking at centimeters here, not inches. So it's overall pretty minimal. So I wouldn't be overly concerned with that. It just, like I said, it just explains this presentation here. And we look down here, he's got good clearance, and just interesting to note. So you'll notice again, I said he's got 1 centimeter up here, and remember that it's 2.54 centimeters for every inch. So again, his excursion is pretty minimal. It's less than an inch even on that right side. But what we see here, and just for future reference, what's interesting is the more circumduction, oftentimes we'll see lower toe clearance on that side, and we actually do here relative to his left side. Again, not a problem. It's pretty minimal in terms of the differences between the two. And then also, he's got good angulation on toe off and heel strike, right? So a fairly normal gait pattern, a little bit of wankiness on the feet. Sometimes, like I said, I may throw in something in the heel. I like using low profile stuff anyway, and never, you can always add more, but it's tough to take away when we overdo it. So let me pull up his running here. Okay, so he's just right around 5 miles an hour. And again, we talked about this where, you know, cadence usually is going to be in the red. I'm not alarmed by this because basically it means, he's taking less steps because he's probably got a really good stride. So that's the reason for that. And again, could be on a treadmill. It looks like. So looking at the stride profile, so we see, he's um, minimal. So that's 178, centimeters versus 171 centimeters. So we do see again that conversion, and I don't know, this may have been taken before you're able to change those settings. Um, so we do see he's got a 7 centimeter difference. So that's about a little bit more than 2 inches. That's not dramatic, but again, 2 inches at 5 miles per hour. If he's an accomplished runner and his pace is typically 6.5 or 7, my curiosity is, does that increase? Does it stay the same? Maybe it decreases. So I'd be curious, what that might look like also at running pace. So don't be afraid to, you know, throw them, a little bit of speed on a second test. They're already set up, they're already on the treadmill and stuff like that. Um, so we look at his strike pattern, or we look at his orientation in ground contact. A little tight on the standard deviation, but it's not shrunk to zero. And again, that typically happens in people that have been doing the same thing for a long, 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 long time. So nothing crazy in terms of the standard deviation. He does have quite a bit of inversion on his strike pattern, but it's very similar between the two. The amount of time difference between loading into transition is pretty minimal. So I'm not overly concerned about that, and it's compensated for in his toe off. Again, I would be interested to see, if these deviations occur when he starts to run faster, right? So we do see on this left side, he's taking more time to get into that in preparation. If he's running faster with his previous Achilles issue and hamstring issue, does it change? Does that deviation really start to increase? Because right, we shouldn't be spending a whole lot of extra time, especially during that transition phase, getting up onto our toes and getting the benefit of all that propulsion. Strike pattern really the same between the two. His strike force is also the same between the two. Like I said, I would be curious, pushing him a little bit faster. What would that look like? If you told me this was his running pace, I would say good for him. I don't see anything too crazy or anything that really needed to be changed, because he looks pretty darn good, if you ask me, with regards to that particular speed. Changing it could be another story. The faster we go, so again, he's not in pain, so you might be able to push him and be able to test him at his pace. And that's always interesting when you throw people on. It's like, what pace do you run at? Or if I'm working with a runner, like in this case for you, say, well, what would you like to run at? And actually have them test at that speed. And you can find out, what kind of deviations are occurring and what could be their limitation in reaching that.